Hello everyone, welcome back to the channel. If you're a man over 50 or you're approaching that milestone, this video is for you. Today we're diving into a topic most men never get told about, but it can have a major impact on your health, comfort, and sexual confidence as you age. We're talking about a simple yet powerful 3-step penis care routine that every man over 50 should follow. It's not complicated, it's not expensive, and it doesn't involve any fancy devices or dangerous pills. What it does involve is consistent, thoughtful self-care that supports hygiene, skin health, and blood flow. 3 pillars of long-term urological and sexual wellness. As men age, many health routines become second nature. Brushing teeth, trimming nails, managing weight, or monitoring blood pressure. But penis care, that's rarely part of the conversation, even though it's just as important. Especially for older men. The truth is that many of the changes men experience after 50, like reduced sensation, erectile difficulty, dryness, or irritation, aren't just a natural part of aging. In many cases, they're signs of neglect in basic maintenance. By adopting a regular, age-appropriate care routine, many of these problems can be prevented, or even improved. Let's start with the basics of hygiene. This is the foundation of penis care, and it's more than just a quick rinse in the shower. As skin ages, it becomes thinner and more sensitive. It also loses some of its elasticity and natural oil production. That means older men are more prone to irritation, dryness, and even microtears if the skin isn't handled gently. Cleaning the penis properly involves using a mild, fragrance-free cleanser. Avoid regular body soaps or antibacterial products. They're often too harsh and can strip away natural oils. Instead, look for cleansers designed specifically for intimate skin, or at the very least, products labeled gentle, or for sensitive skin. Wash daily, especially around and under the foreskin if you're uncircumcised. Failing to clean properly can lead to a buildup of smegma, a thick, whitish substance made of dead skin cells, oils, and moisture. Not only can this cause odor and discomfort, but it also increases the risk of infections like balanitis, which is inflammation of the glands. Even circumcised men need to pay close attention, as sweat and bacteria can still accumulate in skin folds and creases. After washing, make sure to dry thoroughly. Moisture trapped in the groin area creates the perfect environment for fungal infections, especially for men who are overweight or prone to sweating. Use a clean towel, gently pat dry, and avoid aggressive rubbing. Some men even use a hairdryer on a low, cool setting to ensure everything stays dry and irritation-free. Once cleanliness is addressed, the next focus is skin and tissue health. Moisturizing the penis may sound odd to some men, but it can be a game changer, especially after 50. Dry skin isn't just uncomfortable. It can lead to cracking, itching, and increased sensitivity to friction. This makes both daily life and sexual activity less comfortable. Applying a thin layer of a natural, non-irritating moisturizer can help maintain the skin's elasticity and barrier function. Look for products containing aloe vera, vitamin E, coconut oil, or shea butter. Avoid anything with alcohol, added fragrance, or petroleum jelly, which can block pores and cause irritation. Moisturizing should be done once daily, ideally after a shower when the skin is clean and slightly damp. It doesn't take much, just a small amount gently massaged into the shaft and base, avoiding the urethral opening. With consistent use, many men report smoother, more comfortable skin, less itching, and improved sensitivity in a good way. It's not just about comfort, though. Keeping the skin hydrated and healthy can also reduce the risk of skin breakdown, a common issue for diabetic men or those with reduced circulation. Tiny cracks or irritations can become entry points for bacteria, especially in warm, moist areas. By keeping the skin resilient and nourished, you're actively protecting yourself against infections. The third and perhaps most critical step in this care routine is maintaining blood flow and erectile function. Sexual health in older men is deeply connected to circulation. Erections rely on strong, steady blood flow, and as men age, this becomes harder to maintain due to factors like cholesterol buildup, vascular disease, high blood pressure, and sedentary lifestyles. Fortunately, there are simple ways to stimulate and support penile circulation daily. One technique is gentle massage or stretching. This isn't about sexual stimulation, it's about physical health. Regularly massaging the shaft with light pressure, or gently stretching the penis in different directions for a few seconds each, can help stimulate blood flow and keep tissues oxygenated. This is especially helpful for men who aren't sexually active regularly, as lack of activity can lead to reduced responsiveness over time. You can think of it like a form of exercise. Just as you stretch your muscles to keep them flexible, you need to keep the penile tissues active to preserve their function. These exercises only take a few minutes per day and should never cause pain. If done correctly, they can improve nighttime erections, make the penis feel more responsive, and help prevent a condition known as penile fibrosis, scarring or shrinkage of the internal tissues due to long periods of disuse or poor circulation. In addition to massage and stretching, many urologists recommend certain lifestyle tweaks and supplements that support nitric oxide production, a key compound that widens blood vessels and enhances erectile quality. Foods rich in L-citrulline, such as watermelon or certain supplements, have been shown to support erection quality naturally. Pomegranate extract, beetroot, and leafy greens can also help improve circulation. While supplements aren't a replacement for healthy habits, they can be a valuable part of your routine when used responsibly. It's important, however, to always speak with a doctor before adding any new supplement, especially if you're on medication for blood pressure or heart disease. Safety should always come first. Speaking of safety, one major aspect of penis care after 50 is knowing what not to do. Many men, frustrated by changes in performance or sensation, turn to over-the-counter creams, pills, or even questionable devices marketed as miracle cures. These products are rarely regulated and often contain ingredients that can cause more harm than good. Some erection creams can lead to severe burning, allergic reactions, or even long-term damage to nerve endings. Devices like pumps or extender, when used incorrectly or excessively, can cause bruising, ruptures, or blood vessel damage. What older men need is not extreme interventions, but consistent, gentle care rooted in science. That's why this 3-step routine is so effective. It doesn't rely on gimmicks. It doesn't push the body beyond its limits. Instead, it supports the body's natural systems, keeping the skin clean and resilient, protecting tissue health, and encouraging regular blood flow. Another common issue in men over 50 is the shrinking of the penis, or at least the appearance of it. While it's true that aging can cause some degree of tissue shrinkage, this is often made worse by poor circulation, excess fat in the pubic area, or lack of use. Regular penis care, as described in this routine, can help prevent further shrinkage by keeping the tissues active and engaged. In fact, many men report an improved sense of size and firmness after just a few weeks of consistent care. It's not a miracle. It's maintenance. Think of it like stretching a muscle that hasn't been used in a while. With a little attention and regular use, the tissue becomes more responsive, more flexible, and more capable of performing well when needed. Now let's talk about comfort. Many older men struggle with discomfort during erections or intercourse due to thinning skin, reduced natural lubrication, or heightened sensitivity. These issues can be embarrassing and frustrating, but they're also treatable. By regularly moisturizing, stimulating circulation, and avoiding harsh soaps, the skin becomes more resilient and less prone to micro-injuries. If you're using condoms or lubrication, opt for products labeled sensitive or water-based, and avoid any that contain glycerin or parabens, which can irritate mature skin. If you ever notice persistent redness, itching, or discomfort, don't wait. See a urologist. Most issues can be treated easily when caught early. Emotionally, this routine also has benefits. Many men over 50 experience anxiety or self-doubt around their sexual health. Taking just a few minutes each day to care for your penis can help you reconnect with your body in a positive, respectful way. It's not about vanity. It's about self-care. Just as you might stretch your back in the morning, take vitamins, or moisturize your face, this is about keeping every part of your body functioning at its best for as long as possible. And for those in relationships, partners often notice the difference too, not just physically, but emotionally. A man who takes care of himself, including his sexual health, often feels more confident, more capable, and more open to intimacy. That energy is felt in the relationship, whether it's physical or emotional. Financially, the best part is that this entire routine can be done at a very low cost. You don't need to spend hundreds of dollars. A gentle cleanser may cost $5 to $10 and can last a couple of months. A natural moisturizer like coconut oil or an aloe-based cream is equally affordable. If you choose to take a supplement, that might cost $20 to $130 per month. But again, that's optional and should be done in consultation with a healthcare provider. Compare that to the cost of treating infections, dealing with complications from unsafe products, or undergoing treatments for sexual dysfunction. And the routine is not only simple, but cost-effective. Many men don't talk about penis care because they assume it's unnecessary or taboo. But the truth is, just like dental care or heart health, it's essential, especially as we age. The goal isn't to chase youth, it's to age well, to feel good in your body, to stay connected with your partner, and to preserve function and comfort for years to come. This routine doesn't promise miracles. It promises results based on biology, consistency, and common sense. Clean daily with the right product, moisturize regularly, and stimulate blood flow with simple, safe techniques. That's it. No stress, no gimmicks. Just better health through smarter care. The 3-step penis care routine may sound overly simple at first, but the real magic lies in consistency. Just like exercising, brushing your teeth, or eating healthy, small efforts done regularly lead to major improvements over time. Many men who begin this routine report subtle changes at first. Less irritation, reduced dryness, a more refreshed feeling after showers. But over weeks and months, bigger benefits often show up: improved erection strength, better sensitivity, and increased confidence in intimacy. And for men in their 50s, 60s, or even 70s, those changes can have a significant impact on quality of life. It's not about trying to reverse time or achieve unrealistic results. It's about supporting your body to function at its best, no matter your age. One of the key reasons this routine is so effective is because it targets common, age-related issues from the root. For example, many men in their 50s notice their erections aren't as firm or consistent as they used to be. This isn't necessarily a sign of something serious, but it's often linked to reduced blood flow, which is common as arteries begin to narrow with age. Instead of turning straight to medication, this care routine includes gentle daily activities that encourage healthy circulation. A few minutes of massage, light stretching, or even heat therapy from a warm towel in the groin area can improve blood flow naturally. These techniques help prevent what doctors call diffuse atrophy, the gradual weakening of tissue due to inactivity. Just like how your legs get stiff if you sit too long, your sexual tissues can become less responsive without regular movement and stimulation. Skin health is another crucial area that's often ignored. After age 50, the skin loses collagen and elasticity, making it more fragile. Combine this with friction from clothing, dry air, or sexual activity, and problems like redness, flaking, and microtears can become common. By using a mild, natural moisturizer every day, men can dramatically reduce the risk of irritation and keep the skin barrier strong. This also helps preserve sensitivity, which naturally decreases with age. In fact, one of the most common complaints men over 50 have is reduced sensation during sex. Sometimes this is due to nerve function, but often it's caused by dry, poorly cared for skin. Hydrated, healthy skin can hold sensation better, respond more naturally to touch, and even heal faster if there are small injuries or chafing. Cleanliness continues to be a priority as well. Even if you've never had issues with hygiene in your younger years, the risk of infections increases with age, especially for men who are overweight, diabetic, or have reduced mobility. Moist environments, folds of skin, and neglected hygiene can lead to fungal or bacterial infections like jock itch, balanitis, or even urinary tract infections. Older men who wear adult briefs or have difficulty with mobility are particularly vulnerable. That's why proper washing, not just a quick rinse, is important. Lifting the penis and gently washing all sides, rinsing thoroughly, and drying completely are steps that take less than 2 minutes but can prevent uncomfortable conditions down the line. Another major advantage of this 3-step routine is that it provides a sense of control. As men age, many feel frustrated by physical changes they didn't expect. Loss of energy, slower metabolism, changes in libido, or erectile performance. This routine isn't just a medical recommendation. It's a way to reclaim a small but important part of your health. When you take time to care for your body in this specific, intentional way, you're reinforcing the message that your well-being matters. That confidence carries into how you approach your relationships, your doctor visits, and even how you feel about aging in general. It's about being proactive instead of reactive, choosing to maintain function before problems occur. Many viewers ask whether this routine is safe for men with conditions like diabetes, heart disease, or prostate issues. The answer is yes, with slight adjustments. For diabetic men, skin tends to be even more sensitive, and the risk of nerve damage is higher. That means being even gentler with massage and avoiding any skin products with alcohol or artificial ingredients. For men with heart disease or on blood thinners, avoid supplements or treatments unless cleared by your physician, and be extra cautious not to cause bruising or friction during the massage step. Men who've undergone prostate surgery may find this routine particularly helpful, especially when it comes to restoring blood flow and preventing post-surgical shrinkage. In all cases, the 3-step routine should feel comfortable. If anything causes pain, burning, or persistent irritation, stop and consult your healthcare provider. Penis care should feel soothing, not stressful. Let's also address some common myths and mistakes. One mistake older men often make is assuming that no sex means no care is needed. In reality, whether you're sexually active or not, your penis still benefits from regular circulation, clean skin, and proper moisture. Neglecting this area just because you're not currently in a relationship can lead to long-term discomfort and even complications. Another myth is that problems like odor, discharge, or itching are normal after a certain age. They aren't. These are signs that something's off, either an infection, poor hygiene, or a skin condition, and should be checked by a urologist. Also, many men use talcum powder or scented sprays in the groin area thinking they're helping. These products can actually clog pores, irritate sensitive skin, or even increase cancer risk in long-term use. Stick to the basics: so clean, moisturize, and gently stimulate circulation. That's all you need. Let's not ignore how this routine affects mental health, especially in terms of sexual self-esteem. Sexual function is closely tied to confidence, mood, and relationship satisfaction. When men feel disconnected from their bodies, they often withdraw from intimacy, not just physically, but emotionally. By taking a few minutes each day to care for your penis, you reinforce the message that you're still engaged with your health, still capable of pleasure, and still worthy of feeling good in your skin. This mental shift can reignite sexual interest, improve communication with your partner, and help you feel more in control of your aging journey. Even if you're not currently in a relationship, taking care of your sexual health signals a positive, optimistic view of life and aging. This routine is also partner-friendly. In long-term relationships, intimacy can fade not because of lack of love, but because of physical discomfort or insecurity. Many partners appreciate it when their loved one takes responsibility for hygiene, skin care, and sexual well-being. It shows care, maturity, and effort. Some couples even turn the massage step into a bonding experience. Light, non-sexual touch focused on health and relaxation can enhance trust and build closeness without pressure. For single men, adopting this routine can provide a sense of readiness and personal pride. When the time comes for intimacy, you'll feel better knowing you've maintained your health and comfort in a thoughtful way. Let's briefly touch on warning signs. While most changes after 50 are harmless and manageable, certain symptoms should never be ignored. These include persistent redness or swelling, pain during urination, bleeding, sores that don't heal, or a sudden bend in the erection that wasn't there before. These could signal infections, Peyronie's disease, or even early signs of penile cancer. While rare, early detection makes a huge difference. If anything unusual lasts more than a few days or gets worse, see a urologist promptly. It's always better to catch things early than wait and hope they go away on their own. Another helpful addition to your care routine is choosing the right underwear. Tight, synthetic materials can trap moisture and increase friction. Instead, opt for breathable fabrics like cotton or moisture-wicking blends that keep the area dry and comfortable throughout the day. Loose, fitting boxers or briefs with good airflow can reduce the risk of irritation and make daily movement more comfortable. Also, if you're active, especially in warm climates or during workouts, consider changing your underwear more than once a day. Just like you wouldn't wear sweaty gym socks all day, your groin area deserves the same care. If you're wondering how to get started, it's as easy as building the steps into your regular routine. After your morning or evening shower, gently wash with warm water and a non-irritating cleanser. After drying off, apply a small amount of natural moisturizer to the shaft and base. Then take a few minutes to do light stretching or massage. You don't have to do all three at once if that feels like too much. Start with just 1 or 2 steps and build gradually. The key is consistency, not perfection. Many men who begin this routine say they feel more in tune with their bodies. They start to notice positive changes, not just in their sexual health but in their energy, mood, and self-confidence. It's a daily reminder that aging doesn't mean decline. It means adapting, adjusting, and staying engaged with your health in smart ways. This 3-penis care routine is not about chasing youth. It's about protecting your well-being and preserving what matters most as you age. If you're watching this and thinking, "I've never done any of this," don't worry. It's never too late to start. Whether you're 50, 60, or 75, the body still responds to care. These small habits can make a big difference in how you feel and function. And best of all, it doesn't cost much. For less than a few cups of coffee a month, you can support your skin, boost your circulation, and reduce your risk of discomfort or infection. Every man deserves to feel good in his body, to age with dignity, and to stay healthy and confident in every stage of life. This 3-step penis care routine is a simple but powerful way to make that happen. Give it a try, stay consistent, and your body will thank you for it, now and in the years to come.